Hello? Hello? Can you hear me? My this PC became very slow. Mhm. Esther, you can hear me? Can see the screen? Hello? Can you see the screen? Hello? Okay. Then external auditory meatus number 6. Then this is styloid process. Behind styloid process, foramen, stylomastoid foramen. This is carotid canal, and this is foramen lacerum and hypoglossal canal, jugular foramen, foramen magnum, inferior nuchal line, superior nuchal line. Number 7 is external occipital crest. Number 8, external occipital protuberance. Okay. Esther, are you there? Okay. Muscles attached to the styloid process: styloglossus, stylohyoid, and stylopharyngeus. Styloglossus, stylohyoid, stylopharyngeus. Styloglossus, stylohyoid, stylopharyngeus. Okay. This is okay. Cavernous sinus. We have seen optic chiasma, and in the lateral wall, oculomotor, trochlear, then V1, V2, 3, 4, V1, V2, 3 oculomotor, 4 trochlear, then and maxillary, ophthalmic and maxillary, and inner wall we have abducens and internal carotid. Superior ophthalmic vein and inferior ophthalmic vein, and we have. You can hear me? Yes, I hear you. Okay. Cavernous sinus. From here we will get superior petrosal sinus, inferior petrosal sinus. Superior petrosal sinus joined with straight sinus, and they form sigmoid sinus. And sigmoid sinus with inferior petrosal sinus, they drain into internal jugular vein. This is basilar plexus. Superior petrosal join with what? Superior petrosal sinus join with transverse sinus. Transverse. And then they form the sigmoid sinus. And sigmoid sinus along with inferior petrosal sinus, they drain into internal jugular vein. Okay. This is superior sagittal sinus, and this will be inferior sagittal sinus. Yes, inferior sagittal sinus. Superior sagittal sinus, inferior sagittal sinus. Then this is flex cerebri, and down will be flex cerebelli. This is flex cerebelli, flex cerebelli, and here will be the tentorium, tentorium cerebelli, like the tent. Now, inflow from facial vein, emissary vein, superior ophthalmic vein, facial vein, emissary vein, face, FESS, from face, FESS, facial vein, emissary vein, superior ophthalmic vein, and sphenoparietal sinus. Facial vein, emissary vein, uh, these all are coming to the cavernous sinus. Superior vein, facial vein, emissary vein, ophthalmic vein. Ophthalmic have superior and inferior ophthalmic vein. All are draining into cavernous sinus. Also, sphenoparietal sinus. Sphenoparietal sinus. All are draining into cavernous sinus. Then cavernous sinus draining it to one is superior petrosal sinus, another one inferior petrosal sinus. Superior petrosal sinus joining with the transverse sinus and forming sigmoid sinus. Then sigmoid sinus along with inferior petrosal sinus, they are draining into internal jugular vein. Temporalis. Yes. See this temporalis. On that picture we have seen, we thought we are observing this part. Temporalis construction. Temporalis. This is temporalis from the temporalis muscle. Then here is the vessel. External carotid artery terminal branch. One will be superficial temporal artery. Another one is the maxillary artery. And maxillary artery giving branch to different. Okay. Facial nerve. Facial nerve giving branches. Temporal branch. Temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. Also, within the facial canal, they are giving CNG, chorda tympani, nerve to stapedius, and greater petrosal nerve. Then, after leaving the skull, they are giving nerve to stylohyoid, nerve to posterior belly of digestive, and posterior auricular nerve. Nerve to stylohyoid, nerve to posterior belly of digestive, and posterior auricular nerve. Posterior auricular nerve. Posterior auricular nerve. Digestive branch. Branch. Then parotid gland. Parotid gland. Structure passing through the parotid gland. Facial nerve. Then here structure passing through the parotid gland. NVNA. Navana, NVNA, Navana. Nerve, facial nerve, then vein. Which vein? Retromandibular vein. FRAE, yes, it is free. FRAE, free. FRAE. Facial, facial, facial nerve, retromandibular vein, then artery. External carotid artery. No. Facial nerve most superficial, then external carotid artery, retromandibular vein, auriculotemporal nerve, deep parotid. Hmm? Parotid gland location, okay. And salivary duct, second upper molar tooth, Stenson duct. It is also called Stenson duct. It crosses the masseter, fires the buccinator. It crosses the masseter, fires the buccinator, and drain adjacent to the second upper molar teeth. Then structure passing through the gland. FRAE. FRAE. F is facial nerve. R is retromandibular. R is retromandibular vein. Navana. NVNA. Navana. Free Navana. Free Navana. F facial nerve. R retromandibular vein. A auricular. A auriculotemporal nerve. E external carotid artery. It will be the most deeper. External carotid artery also will go through parotid gland. Okay. So facial nerve, retromandibular vein, facial nerve, retromandibular vein, auriculotemporal nerve from the posterior trunk of the V3. Okay, and E is external carotid artery. Okay. Superior cervical ganglion, middle cervical ganglion, and inferior cervical ganglion. Superior cervical ganglion C1, middle cervical ganglion C5, inferior cervical ganglion C8 T1. We have seen this one. Upper motor nerve, we have seen tongue. Tongue. 5, 7, 9, 10, 12. It is like clockwise. 5, 7, 9, 10, 12. 5 is V3, 7 lingual, 9, 10, 12. 5, 7. 5 is in the tip. If we look from the tip of the tongue, 5, 7, 9, 10, and 12. These are the nerve relation of the tongue. 5, 7, 9, 10, 12. 5 is in the tip of the tongue. Uh, General sensation by the mandibular division of the lingual nerve, and general sensation via mandibular division. Mandibular is V3. Mandibular division of the trigeminal nerve. Yes, means 5. Okay. So general sensation via mandibular division of the trigeminal nerve, then spatial sensation test via the chorda tympani. Chorda tympani is a branch of facial chorda tympani. Then This is anterior two third. Okay, in anterior two third we have two. One is 5 and 7. 5 gives the general sensation of the whole of the tongue by lingual nerve, and spatial sensation, that is taste sensation we get from the quarter tympani, which is branch of the facial nerve. Then we can go to posterior one third. Posterior one third, both general sensation and spatial sensation is supplied by the glossopharyngeal nerve 9. Then come to number 10. 10 is here some muscle. Which muscle? Number 10. 10 is palatoglossus. 10 is palatoglossus. See the root of the tongue. Most proximal is palatoglossus. Palatoglossus, which elevate the tongue posteriorly. Palatoglossus vagus. Palatoglossus vagus. Palatoglossus vagus. Palatoglossus vagus. Palatoglossus vagus. And then 10 finish, then come 12. This 12 is very related to the base of the tongue, and these are the extrinsic motor hypoglossal. We said all the hypoglossal supplied by the hypoglossal except palatoglossus. Palatoglossus is by vagus, and other hypoglossal like intensive muscle, genioglossus, hyoglossus, styloglossus, GHS, genioglossus, hyoglossus, styloglossus, genioglossus, hyoglossus, palatoglossus. Now, which one is which? How we know? Genioglossus, hyoglossus with hyoid bone, hyoglossus little big, hyoglossus, because this is the hyoid bone down. Hyoid bone. Hyoglossus, and here is styloglossus. Styloglossus will go with styloid process, right? Here will be the styloid process. You see here, this is the styloid process. From the styloid process, we'll get styloglossus. Glossus means related to the tongue, and styloid process. So styloglossus with the hyoid bone, hyoglossus, and I know genioglossus, how this name came. Genio maybe jaw, lower jaw. So jaw, lower jaw, genioglossus with the lower jaw or the mandible, lower mandible. Okay, genioglossus, hyoglossus, styloglossus, all are by motor, hypoglossal, and except palatoglossus, palate, because here will be the soft palate and hard palate. Palatoglossus, which is by vagus, palatoglossus by vagus. And now the nerve. Here, nerve we have this is called a tympani. You can see this one, and here three nerve will be hypoglossal. We can see it is very close to, and marginal mandibular and lingual. So lingual already we have seen here. This is the lingual nerve, then marginal mandibular and hypoglossal. Nerve, three nerve related with this. When we do the submandibular gland surgery, three nerve in risk. One is marginal mandibular nerve, lingual nerve, and hypoglossal nerve. So here, so anterior two third 5 and 7, then posterior one third 9, then for palatoglossus 10, and other three genioglossus, hyoglossus, and styloglossus for 12. This is very bad picture. This is facial prominence of the facial canal, facial nerve, facial nerve, facial nerve, facial nerve. This is internal jugular vein. Okay. Esra, are you there? Astra?
Yes. Yeah.
You're sleeping?
No.
Yes.
No.
Then you can ask.
Okay. Hypoglossal relation to internal carotid cause a bifurcation.
Esther, now you are in the condition where we were there before 1 year. Before 1 year, that time each and every individual we look. Sometimes we Google, and this thing. But now you need to tell me, Shadanshu, this question is there in your exam stem. Just you answer me. What is number 8?
They will ask you as well. They will ask you.
Now she's feeling sad and angry. See her voice. Okay. A relation with external carotid and hypoglossal. Hypoglossal. Uh, See, hypoglossal external carotid will go through the parotid gland. Here also you can see. mm, Here, see, hypoglossal uh, through the parotid we will get external carotid, and hypoglossal will come here to give supply here in this. So we can say hypoglossal will. Your question was hypoglossal will go top of the external carotid or down.
Mhm.
Is this a question for now?
Okay, okay. This picture I found in the answer.
This question maybe will be asked in FRCS.
Uh,
This is very higher level question, my dear.
mhm.
In the exam hall, we just pray to Almighty. At least we can say the name.
You know, inshallah, easier.
So what is your solution? What is the answer? Hypoglossal goes over the external carotid or below the external carotid?
I don't know. It's not important.
Maybe over the external carotid. Maybe because common sense what it says that artery will be always in the deeper structure, right? In that sense,
Mhm.
we can say external carotid artery will be down, and hypoglossal will come over it.
Yeah.
See here the picture, hypoglossal nerve. You can see this picture. Hello, she left. Okay. Hello, hello. Hello, can you hear me or my internet gone? I don't know. Hello.
Yes, do you hear me?
Yes, I was asking. Nobody replying. I don't know.
I didn't hear you.
Okay, no problem. We can continue.
So I was done.
Yeah, she sent message. She went for the prayer.
Okay.
Hello.
Yeah.
This head and neck only it will take time because it is the complicated pictures. Other system will not take this much time. So your answer is here. External carotid will remain deep and hypoglossal will come over the external carotid. Not only external, both external and internal carotid over both of the vessel. You can see in this picture.
Yeah, yeah. The rest is hypoglycemic about it. There is superior about middle, put the okay.
Okay. I know you have tendency for vascular surgery. Don't worry.
Mm-hmm. That's it. Was closer. Fine. It's a specialty.
Okay. Okay. Now we are almost in the end. Start this one.
Okay.
Asma, you're there?
Yes.
Yeah. Okay. Yes. Esra, ask. Then we will answer.
Yeah, you sit. You sit. Was closer.
Mhm.
Okay. And
Mhm.
it.
Number
It.
8. Cerebellar tonsil.
Okay. Nine.
9 is cerebellum.
Nine. 13.
13. 13 is cisterna magnum. Cisterna magnum. Cisterna magnum. Cisterna magnum. Cisterna magnum. Cisterna magnum.
Is 15.
15 is the fourth ventricle.
Was 18.
18. 18 is splenium. Splenium of the corpus callosum. Splenium of corpus callosum. Splenium of corpus callosum. So corpus callosum has actually 2, 6 and 18. 2 is genu. Oh no, 2 they have written anterior cerebral artery. Okay. 2 is anterior cerebral artery. Okay. 6 is body of the corpus callosum. 6 is body of corpus callosum. And 18 is splenium of corpus callosum. Yes.
Mm.
Then
19.
19, hypothalamus in the wall of third ventricle. Thalamus in the lateral wall of the third ventricle. Thalamus, thalamus, not hypothalamus. Thalamus in the lateral wall of the third ventricle. Thalamus in the lateral wall of the third ventricle. Okay.
Mm. Green olive. Green olive.
Green arrow, interpeduncular cistern.
Yellow.
Yellow is prepontine cistern,
Red.
and red is suprasellar cistern. Suprasellar cistern. Suprasellar cistern. Then 17 is maybe pituitary gland.
Mm-hmm.
Cemetery pituitary gland. Above it is suprasellar, because silla is pituitary. Suprasellar cistern, and
Green.
this green
Green
is
matter.
prepontine
Interventional.
interpeduncular cistern. Interpeduncular cistern, and yellow prepontine cistern. Prepontine cistern. Prepontine cistern. Prepontine cistern. Five. Five is Five is basilar artery. Five is basilar artery. Five is basilar artery. Two is anterior cerebral artery. Basilar artery, anterior cerebral artery, anterior cerebral artery, and five is basilar artery. Okay. So suprasellar cistern, interpeduncular cistern, pontine cistern. Okay, cisterna magna. Hmm. Okay, this picture very rapidly we'll see. It is not very important, but just we'll have a see. This is thalamus. Thalamus, below it hypothalamus. Thalamus, hypothalamus, then optic chiasma. This is optic chiasma. Optic chiasma. Optic chiasma. Then this is corpus callosum. Corpus callosum, and posterior part splenium of corpus callosum. Okay. Then thalamus, hypothalamus, corpus callosum. This is frontal lobe. Frontal lobe. This is central sulcus. Central sulcus. In front of it is precentral gyrus or gyrus. Precentral gyrus. Gy or guy?
Red.
Guy. Gyrus. Gyrus. Precentral gyrus. Central sulcus. Precentral gyrus. Behind postcentral gyrus. Then limbic lobe. Limbic lobe is above the corpus callosum, and this is totally frontal parietal. This is parietal lobe. Parietal lobe, and before parietal, in between there is occipital. So occipitoparietal sulcus. Occipitoparietal sulcus. Occipitoparietal sulcus, or parieto-occipital sulcus. Parieto-occipital sulcus, and occipital lobe. Below it we have cerebellum. 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 What? Huh?
That's it.
Is it
What
anything
is this?
related with
Cere-
your word? I
ce-
mean, any of your word in your language? I don't know.
yeah.
Okay. Lala.
Yeah.
Okay. Cerebellum. Cerebellum connected nicely with the fourth ventricle. See, cerebellum directly connected with the fourth ventricle, and they have a communication going up, up, and they are connected with aqueduct of midbrain. Hmm. Then we have pons medulla oblongata. Both side basilar or vertebral artery comes here in front of the pons, medulla oblongata, and in the lower border of the pons. When they come together and they marry and they become basilar artery. Herniated cerebellum. Herniated cerebellum. This one, herniated cerebellum. Herniated cerebellum. Okay. Arnold Chiari malformation. 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 Mid-sagittal section showing small posterior fossa content, downward displacement of the cerebellar vermis, and deformity of the medulla. Arrow. Deformity of the medulla. Uh, okay. Here also cerebellum displaced. I think cerebellum came down totally. Here. And narrow indicate approximate lateral of the foramen magnum. Hmm. Okay, this is common meningioma. We have seen this picture. No description, nothing. Okay. Here we have fourth ventricle. Then this is foramen magnum. Foramen magnum. Some going up. Arachnoid villi, villi, villi. This is lateral ventricle. From the lateral foramen Monro, third ventricle. From third ventricle, aqueduct of Sylvius, fourth ventricle. Okay, yes, here is the picture. Lateral ventricle to through foramen of Monro, both side. Lateral ventricle, then through foramen of Monro, they will come to the third ventricle. From the third ventricle, aqueduct of Sylvius. Aqueduct of Sylvius, they will come to the fourth ventricle. So lateral ventricle to third ventricle to fourth ventricle. L34, L34. Lateral ventricle, then third ventricle, then fourth ventricle. Lateral ventricle to third ventricle, foramen of Monro. From third to fourth, aqueduct of Sylvius. And from fourth ventricle, they have two root. From fourth, they have medial and lateral. They have medial and lateral. Medial is Magendie and lateral is Luschka. M for M, L for L. Magendie, medial median aperture foramen of Magendie, and lateral is Luschka. Then they will reach to the subarachnoid space. From subarachnoid space, they will be again absorbed into arachnoid villi, and they will drain into superior sagittal sinus. So again, lateral to third to aqueduct of Sylvius will come to the fourth. From fourth, foramen of Monro. No. From lateral to third will come through foramen of Monro. Then third to fourth, aqueduct of Sylvius. Then from fourth, they have lateral foramen of Luschka and medial foramen of Magendie. They will come subarachnoid space. From subarachnoid space, it will be absorbed into the arachnoid villi, and they will drain into superior sagittal sinus. Then from superior sagittal sinus, they will come genu body splenium. Genu body splenium. Yes, this is vertebral artery, and basilar artery. Then posterior cerebral artery, posterior communicating artery. Posterior communicating artery, if there is an aneurysm. Okay, posterior communicating artery, internal carotid artery, and then it is medial cerebral artery. From here will go anterior cerebral artery, and in between anterior communicating artery. Medial cerebral artery. If medial cerebral artery, number 11 is medial cerebral artery. By any means, if medial cerebral artery is occluded, what will happen? These patients, suppose this is his brain, these patients left side, upper half of the face will be, this picture should be opposite. If this side is occluded, I am occluding medial cerebral fluids here. This is medial cerebral artery. If medial cerebral artery, this is left side and this will be the right side. So left side medial cerebral artery occlusion will cause right sided lower half of the face. Lower half of the face will be hemiplegia. If left side, this is right side. So hemiplegia of the lower half of the contralateral face. Hemiplegia of the lower half of the contralateral face. Hemiplegia of the contralateral upper and lower extremity. Okay. And aphasia in the dominant hemisphere. Arteries of the base of the anterocerebral artery. Okay. Number 2 is anterior cerebral artery. Number 4, anterior communicating artery, anterior cerebral artery. Number 2, anterior cerebral artery. Number 4, anterior communicating artery. Number 7 is the basilar artery. Basilar artery. Number 7, basilar artery. Number 9, internal carotid artery. 999 internal carotid artery. 11, medial cerebral artery. 17, posterior cerebral artery. Posterior cerebral artery. And 18 is the posterior communicating artery. Posterior 24, superior cerebral artery. 24, where is 24? 24, superior cerebellar artery. Okay. Yes, extra ask.
30.
That is medial cerebral artery.
31.
31, ophthalmic artery.
39.
Posterior communicating artery.
1.
Anterior cerebral artery.
Yes. I will know. I can see it. I will do it.
22 is internal carotid artery. It is entering as 22 internal carotid artery. When it entered, see, this is the carotid canal, and after entering carotid canal, this is they are making S. See, it is like S. So that's why if we get a cross section at this level, we will see two branch of the internal carotid artery.
Yes, that was your thing.
Yes, I was very confused, but one of my professor, she cleared it, and I was very happy, and I will never forget in my life. And it is confusing. Anyway, so after entering the skull through foramen lacerum, it will go over the foramen lacerum. Then it will give its first branch, that is ophthalmic artery. First branch we know, ophthalmic artery. Then it goes little forward. Forward branch is anterior cerebral artery. So number 1 is going forward. Actually, this is a lateral view. Okay, half of the picture. The full picture. This is the full picture. I mean, uh, this is this is right and this is left. Suppose you are watching him from the back, from his back side, and this is his picture. But this picture, you have cut his head through the cerebral hemisphere, and you are looking only the right section from the medial border, medial surface. So you can see this is anterior cerebral going anteriorly, and posteriorly this 39 is coming behind to maintain the circle of wheels, because here also will be one, and from this side also there will be one to go the back side, and then there will be communicating artery posterior. So this one is posterior communicating artery 39. One is anterior cerebral artery.
Communicating, not posterior cerebral.
No, not posterior cerebral.
Or the direct branch, right?
Hmm?
Not the direct branch.
No, no.
We can put up for a circle of this.
Yes. Here, if we see, then it will be easy. Mm,
When then the first for this above this.
mhm. Yes. Yes. Continue, Esther.
Yes, above this can go on. To want you to adopt circle coded picture. Yes.
Uh-huh. More above?
Yes, this is yeah.
Okay.
Which active internal carotid is posterior communicating.
Uh-huh. Continue.
Yes, the posterior cerebral is already branch of the basilar root of the cerebral cord. Okay, I got it. Okay.
Just give me 1 minute. You can discuss circle of wheels again. I'm listening to you.
Okay. And straight it is through. لا بس يعني the surprising for me that internal carotid continue as middle cerebral.
It is not the good picture, and this is not the correct one. This is just a concept to give us idea about the, but medial cerebral artery. It is showing that medial cerebral artery coming, and then it is giving the branch of internal carotid and this anterior communicating anterior cerebral. But this is not the true. Or in another sense, you can think like this: internal carotid artery actually starting from here, from mid side. This is the direction. If you think in this way, then it will be easy. Now we can match.
Yes, if I think of this, it is a continuation after giving it's a branch, but at the same continuation of same direction of internal.
Because you need to think about the ophthalmic artery. First branch, ophthalmic artery. They are giving the ophthalmic artery first. You can see upper right.
Where?
Upper right, ophthalmic artery. Means it is going in this direction. Because we know the first branch is ophthalmic artery. So ophthalmic artery, then he will give other branches.
Anterior cerebral, then middle cerebral,
Mm-hmm.
then posterior communicating.
Yes.
Okay. And the basilar artery branches are the posterior cerebral and anterior inferior cerebellar artery and posterior inferior cerebellar artery. the posterior is from the vertebrae. Okay, continue. Frontal branch, superior cerebellar artery. Mm. Mm.
Mhm.
Okay, and can you go to the imaging again? It is an ear or
Yeah, now you can answer this numbering. This is important one. Maybe it will come in our exam. Answer.
okay, so the first branch, so it is ophthalmic. And one, the second branch going forward, it is the anterior cerebral. And 30 is middle cerebral, and 39 is posterior communicating. Okay.
Tamam.
Huh?
Tamam.
تمام تمام
Kullu tamam.
والله جدا
Inang get it? I don't know. It is not common.
جدا جدا جدا
Okay, now this one.
general character even
Anyone can illustrate? Just explain the picture. What you see. Isra can explain, or Asma.
I don't understand.
First, see the first picture. Internal cavity artery coming up. Then what is happening?
Closure.
Yeah.
There is an occlusion. Yes, they mean that there is an occlusion through the anastomosis with the vertebral artery. Yes. Some patient may recognize symptomatic chronic carotid occlusion. Okay. So let us cerebral.
Isra can discuss this picture.
What are you saying?
Can discuss. Anyone can discuss this picture. Just in the left side picture, you can see internal carotid artery in the left side. But same picture should be there in the right. I mean left side. We can see only in the right side. See what is written. Right internal carotid artery injection given, and it went up, and then internal carotid artery, then medial cerebral artery, then anterior cerebral artery, then through the anterior communicating artery, again it is going to the left side medial cerebral artery. Then to complete the circle of wheels, it should come back, right, this side. But this side there is no flow of the dye, means it is blocked. Now where is the block? Whole right side also we cannot see anything. Left side. That means now you can see, read the second picture. Now they have given injection, left common carotid artery injection, and this injection, common carotid artery, through common carotid artery it is going, and then it is going to the external carotid artery. Unfortunately, it is not entering into the internal carotid artery. That's why in the first picture Internal artery course is not visible, means there is a occlusion or block in the right internal carotid artery. But when dye was given in the common carotid artery, the dye is going through the external carotid artery, and we can see the branches of the external carotid artery: superior, laryngeal artery, then lingual artery, facial artery, then the terminal branches like temporal artery, maxillary artery. Okay. Now this one, Esther can ask quickly.
Okay, but this is not present. Why? Why?
Asma, you can answer.
Uh, okay, it is accusative. Accusative. Why? Mhm. Why? Why? There is red substance important. Why is attachment of titanium secondary? Okay, attachment of titanium secondary. Okay. It take care when pronounce it. Take care. شو is okay.
My camera is off. How you can see?
Hispanic are basically stigma is to attach stigma again. Stigma? Cresta, oh, cresta again. Yeah, cresta. Okay. Cresta again. Alex boy. Alex cresta. 19. 19. Motor 23. Easy. 26. 24. Uh, 5. 5. That's a version of titanium cycle. It's a version. It's a version of the cycle, and one is Phoenix cycle. Titanium cycle. And it is Phoenix cycle. Very difficult. Yes, it's very difficult. One, that's why also asking me to answer. It's very one, one, one is the absent nerve. Five, attached border of sometimes below. مش قادرة أتوقع بس ماشي. Eight, panic, going to crystal gun. Okay. 19, 19, the oculomotor nerve.
Hello, Misra. Hello, can you hear me? Hello.
Yes, yes, I can hear you.
Okay. PC became very slow. Okay, you can ask me rapidly. I will try.
One, one,
One, one is abducens.
8,
Eight is uh, eight is flex cerebrally attached to the cristagalli.
19,
Where is 19? 19 here. 19 is oculomotor nerve.
yeah, 23,
23. 23 is optic chiasma.
24,
24 optic nerve.
5,
5, 5, 5 here. Attached margin of the tentorium cerebelli. 5. Attached margin of the tentorium cerebelli. Hmm. 26 is pituitary stalk. 26 pituitary stalk. 36 tentorium cerebelli. That is 36. 36. This is tentorium cerebelli. 36 is tentorium cerebelli. Okay. Tentorium cerebelli. 36 is tentorium cerebelli. 38 trigeminal ganglion.
thanks,
Same picture. I think we are done. Okay, then abdomen.
Okay, abdomen.
Hmm. You can give a call or something to asthma.
Okay. The same.
I didn't send.
It's the same.
Same link, yeah, same link. From the link, I tried to call her.
She was
Hmm?
waiting for link, but I told her Jan wants to.
Can see the screen now?
Yes, no.
Can see the screen?
Mm.
No?
Yes, now we can.
Okay. So this picture we know which is structure, which one. We'll go very rapidly. We will read thoroughly all the question. Here now only we are for the picture.
Yeah, for picture.
Only for the picture. Yes, in this one you can ask. Rabbit.
I'm trying to answer the resolution of things. Not, it is abdomen or the
Yeah, abdomen. Abdomen. We started abdomen. Head and neck, that was the last.
okay. Okay. Two.
Two,
Can you see what it
celiac trunk.
three?
Celiac trunk.
Three. What is it?
Two is
Yes.
the laser sac curvature. Sorry.
Okay, three.
Three, I think hepatic, common hepatic artery.
Okay, seven.
Common hepatic artery.
Seven.
Seven maybe gastroduodenal. Gastroduodenal.
Ten.
10. 10. 10. 10. Yes, 10 should be hepatic. Yes, 10 is hepatic because it is going to liver from starting from 3. 3 is common hepatic, then giving 7 gastroduodenal and 10 is hepatic artery proper. Okay, then
Mhm.
huh?
11.
11 is left gastric.
12.
12 is a marginal left marginal maybe left gastric anterior branch. Okay, left gastric anterior branch.
Mm. 17.
17. Where is 17?
That is
Above the liver.
that in the
Where 17 is not in the picture. 17 left portal vein. Where is 17? Left portal vein.
Can you work that in the picture?
This is picture. Hmm.
Can you
Left
do it again?
here.
Mm. I understand it. Okay, it's okay.
17. I think not here. Another picture maybe.
I think it's my book. The picture, if you haven't given it complete.
Okay. 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 No problem. Left portal vein. Then yes. Please ask.
Okay, I cannot see. 19.
19 liver. Also cannot see. Left lobe.
Mm. 19.
Left lobe of the liver. It is not visible. Maybe.
I sent you the picture in the WhatsApp.
Mm-hmm. Okay.
20, 22.
22. 22 is again branch from the left gastric. 22 maybe superior branch of left gastric. 22 esophageal branch of the left gastric. Yes. Esophageal
Supergel.
esophageal branch. Esophageal branch of the left gastric. Anything else?
Mm.
25.
Next week.
25 is splenic. Big one. 25 is 2 is celiac trunk. Celiac trunk has 3 branches. Left gastric 11, splenic 25, and common hepatic 3. Okay, this picture.
Okay. Okay. 6.
Number 6. 6 is a falciparum ligament.
1.
1 here is aorta.
And
8. 8 is 8 is inferior mesenteric artery. Inferior mesenteric artery. Aorta. Inferior mesenteric artery. Yes. Fast.
2. 9.
9.
Is that
Hmm? 9 is inferior mesenteric vein.
10.
10, where is 10? 10 is 10 is inferior vena cava. Where is inferior vena cava? Inferior vena cava. Inferior vena cava will be which side, right or left? Vena cava will be left. Maybe this one here. I'm not sure.
I think it's in the second picture.
I will see. Missed it. This is inferior vena cava. Hmm.
17.
Huh?
17.
17 is left lobe of the liver. Right lobe. Right lobe. Hmm.
20.
20.
Tw-
Where is 20? Ah, 20 head neck. It should be neck. Head neck. 22 is pancreas, uncinate process. Okay, 22 uncinate process. Then 20 is head, and 19 body, and 21 is tail. 19 is the body. Okay, so 20 is head of the pancreas. Okay,
26.
26
29.
is splenic artery. Splenic artery. This one. Then 29. 29. 29. This is 29. Superior mesenteric artery. And 30 is superior mesenteric vein. Superior mesenteric artery, splenic artery, falciparum ligament, aorta, inferior mesenteric artery, inferior mesenteric vein, falciparum ligament, inferior vena cava, aorta, splenic artery. Okay.
31.
31 is this ureter. This is the kidney. From the kidney it is coming down. Okay, here what we can see, marginal artery. This is marginal artery, left colic artery, left colic artery, left colic artery 11, inferior mesenteric artery, very bad condition, inferior mesenteric artery, sigmoid artery. This picture is difficult. Inferior mesenteric vessel. Number 5, inferior mesenteric artery. Where is 5? 5, 5.
And 6 is the left column.
6 is left colic artery.
And 14, sigmoid artery.
14 is sigmoid artery.
So left colic and sigmoid. What else in the food gives? It gives the left colic and sigmoid and superior rectal.
This is
First branch of left colic, then it gives the sigmoid, then it gives the superior rectal.
inferior mesenteric will give sigmoid artery, superior rectal, left
And
colic.
left, yes. And superior rectal here is number 18. Below the sigmoid.
Hmm. Okay. Number 14 is sigmoid artery. Okay. This is ascending branch of the left colic. So this is left colic artery.
Sorry, superior rectal is 17.
Hmm.
18 is the vein. Okay, so number 5 gives above 6, which is left colic. Transverse it gives 14, which is a sigmoid. Below it gives 17, which is a superior.
Hmm. This is superior rectal, below superior rectal, and these are the branches of the sigmoidal branch. Sigmoid artery, superior rectal artery, sigmoid branches. Then left colic artery. Left colic will give ascending branch and descending branch.
Mhm.
Here, okay, now can ask.
One.
One is abdominal aorta and aortic plexus.
And up. Three.
Three, right common iliac.
Four. Iliac arch.
Hmm?
Four iliac.
Four is right common iliac vein.
Left right left because it's open on both sides.
Hmm?
Three is written right and left. Then yes,
I didn't understand.
you don't have to say left or left because they give the same number for both sides.
Oh, okay.
Seven.
Oh, okay, okay. Yes.
Seven.
Seven is external iliac artery.
Eight.
Eight, external iliac vein.
Uh, 23.
23. 23 inferior vena cava.
25.
25. 25.
Yes, is 39.
25 internal cavity. Internal.
40.
39 is testicular vessel. 39 testicular vessel. Testicular vessel. And 40 is ureter. 40 coming here, above, going down. Ureter. Hmm. This one. Hello. Yes. It is there in the file, page number 18. 3. 3 is the head of the pancreas. Hello. Your voice is not clear. Voice echo. Okay, 3 is head of the pancreas. Then 4 ileocholic artery. Where is 4? 4 is ileocholic artery. Okay. Ileocholic artery. 4 ileocholic artery. Then 5 jejunal branch of the superior mesenteric artery. 5 is hmm? Which one? 6. 6 is laser sac. I think everyone sleeping.
7. No.
Ah,
7.
7. 777. 777. Bond series 7. Medial colic artery. Medial colic. Medial colic artery. Number 7. Medial colic artery. Okay. 14 is the superior mesenteric artery. 14 superior mesenteric artery. From 14 they are giving first is 7 medial colic artery, then 10 right colic artery, then 4 ileocolic artery.
And 5.
Jejunal branch of the superior mesenteric artery. Jejunal.
7 is middle colic and 10 is
Right colic.
And 4 is ileocolic.
Ileocolic. And 5 is jejunal branch of the superior mesenteric.
And then right and ileocolic.
Okay, then
Is reflected in okay. 13.
Superior mesenteric artery. 15 superior mesenteric vein.
16.
16 is tail of the pancreas.
17.
17 here transverse colon.
17.
Hmm?
17. Okay.
17. 17 transverse colon here. 17 transverse colon.
Mm.
This picture we have seen again rapidly. Number 2, body of the stomach. Number 6, fundus of the stomach. Number 18, pyloric antrum. Number 19, pyloric canal. And 23, superior or first part of the duodenum.
6 parts of the stomach.
Hmm. Okay. This is all about abdomen. You can go to upper limb.
It's all about okay.
Hmm. Mainly the picture. We are watching the picture. Then we will read the whole. This one. This is brachial plexus. Uh, Number 17 is median nerve. 17 median nerve. It is coming from the two root. One is medial. Uh, so medial head of median nerve. Number 16. I think 16. Medial root of median nerve. Median nerve. And number 8. 8 is the. You can see this lateral picture. This picture it is moved. Number 8 is the lateral lateral root of the median nerve. Number 8 is the lateral root of the median nerve here. Number 8. And number 16 is the medial root of the median nerve, and they are forming number 17, which is the median nerve. Then we have number 16. Okay, say number 18, musculocutaneous nerve. Number 18 should be number 18. Here is the 18, musculocutaneous nerve. Musculocutaneous number 18 is musculocutaneous nerve. 18 musculocutaneous nerve. Number 1, axillary nerve. Axillary nerve. These are posterior cord branch. Axillary. Okay. So cord number 6 is lateral cord. See from the above, number 6 is lateral cord. Number 20 is posterior cord. Lateral cord, posterior cord, and 12 will be the medial cord. Number 6 is lateral cord. 20 is the post. No, no, 6 is the lateral cord. Lateral cord. 20 posterior cord, and 12 is medial cord. Then number 18 musculocutaneous, number 1 axillary, number 8 is the lateral root of median nerve, number 16 medial root of median nerve. Then number 26 here also 26, this is ulnar nerve. Number 18 musculocutaneous. Then finish.
21 is radial.
21
It's radial nerve coming from the posterior cord.
21 is radial nerve. Where is 21? I cannot see.
It's radial.
Here 21. This is 21 radial.
And 1 is axillary.
Hmm. Okay, this one. Number 1 is acromion. This is acromion. Number 2, coracoid process. 2 is coracoid process. 3, glenoid cavity. 3 glenoid cavity. 3 glenoid cavity. 5, infraglenoid tubercle. 5, infraglenoid tubercle. Infraglenoid tubercle. Infraglenoid tubercle. Infraglenoid tubercle. 8, spine. 9 is 9. 9 is supraglenoid fossa. 9 is tubercle. Supraglenoid tubercle number 9. 5 is infraglenoid tubercle. Supraglenoid tubercle. Acromioclavicular joint. This is how the joint forms. Huh? Huh? Sorry?
Okay, no, nothing.
9 supraglenoid. 9 supraglenoid. And 5 infraglenoid.
But coracoid process articulates with the shoulder and the acromion articulates with the clavicle. Right? Or the opposite.
Acromion articulate with the clavicle. And they form acromioclavicular joint.
Acromion.
Number 1 acromion of the clavicle. Number 3 is acromion of the scapula. 4 coracoid process. Number 1 acromial end, sternal end. 5, we have seen this one before. This picture. Number 1 axillary nerve. Where is 1? This is axillary nerve here. Just give me 1 second. Okay. Very sleepy. So I have to stand up. Uh, Again, number one is the axillary nerve. Number one, axillary nerve. Number one, axillary nerve. Number five, where is, where is five? Here is written five. This is latissimus dorsi. Okay, okay. Number six, posterior circumflex humeral artery. Axillary artery, sorry, axillary nerve. Axillary nerve. This is axillary nerve. And then number six, this is six, posterior circumflex humeral artery. Hmm. Axillary nerve number one. Then this is number six, posterior circumflex humeral artery. Number 10, teres major. 10 is teres major will be down and minor will be up. 11 should be up. Yes, 11 is teres minor and this is 10 is teres major. And in between which number 2 is circumflex scapular artery. From here coming circumflex scapular artery. This is triangular space, I guess, and this will be the quadrangular space here. In quadrangular space, we have axillary nerve and posterior circumflex humeral artery, and in triangular space, we have scapular circumflex scapular artery, and in the lower triangular space, not space, it is called triangular something. Here we will have radial nerve and profunda brachii. Yes, this part we can have a look because it was not in any of the here. This is triangular space and quadrangular space, and down is triangular interval. Triangular interval. One is triangular space. Triangular space we will have circumflex scapular artery, and quadrangular space we will have circumflex humeral artery and axillary nerve. And triangular interval we will have profunda brachii and radial nerve. Hmm. Here is a triangular space. In triangular space, we have circumflex scapular artery. This is triangular space. Triangular space. Circumflex scapular artery. How it is formed? Superiorly by teres minor, inferiorly by teres major, and laterally by long head of triceps. And quadrangular space, this is quadrangular space. How it is formed? Superiorly by teres minor, inferiorly by teres major, medially by lateral head of long head of biceps femoris, and laterally by medial head of humerus. Laterally humerus, medial border, medially triceps, long head, teres minor superiorly, major inferiorly, and content axillary nerve, posterior circumflex humeral artery, axillary nerve, posterior circumflex humeral artery, and triangular interval. In the triangular interval, we have triangular interval. How it is formed? Superior border by teres major, teres major, and lateral border of triceps, lateral head, medial border Medial border, triceps long head. Ha, ha. So triceps both head forms this one, and interval, radial nerve, deep artery of the arm or profunda humeral. I said femoris before, it is not femoris. It should be profunda brachii. So this is the triangular space, quadrangular space, and this is triangular interval. Profunda brachii artery and radial nerve. This picture, number one, acromion. Mhm. Continue.
Okay. Five.
Number five is deltoid muscle.
Four.
Four is clavicle.
Nine.
Nine is supraspinatus muscle.
Six.
Six, six is glenoid cavity.
Okay. 10.
10 is supraspinatus tendon. 3, axillary recesses of shoulder joint. 2, axillary nerve and circumflex humeral vessel. Axillary nerve, circumflex humeral vessel. This part. Axillary nerve, circumflex humeral vessel or artery. This is greater tubercle, lesser tubercle, head, surgical neck. This is anatomical neck, and this is surgical neck. 10. Surgical neck, surgical neck, surgical neck. Okay. Us. Number two, capitulum. Number two, capitulum. Number five, lateral epicondyle. Number five, lateral epicondyle, and seven is medial epicondyle. Seven medial epicondyle, five lateral epicondyle. Then number 13, trochlea. 13 is trochlea, and 10 is fossa, olecranon fossa, olecranon fossa, and 3 is coronoid fossa. 3 coronoid fossa, 3 coronoid fossa, 10 is olecranon fossa. 13, 13 trochlea.
Oh.
13 trochlea, 5 lateral epicondyle, 7 medial epicondyle, 2 capitulum, 2 capitulum, 7 medial epicondyle, 13 trochlea. Number 2, basalic vein. Hmm. 2 is basalic vein.
Oh.
Here is 2, basalic vein, and 6 is cephalic vein. 6 is cephalic vein. 6 cephalic remains in the lateral side because cephalic start with the scaphoid, I mean snap box. So from there it ascends up, 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 and it remains like lateral. So cephalic vein 6 lateral and 2 basalic vein medial side, and 11 is cephalo. This is median cubital vein. 11 median cubital vein. 2 basalic vein, 6 cephalic vein, and 11 median cubital vein. Median cubital vein. This structure. Hello, Esra.
Yes.
Both of you are sleeping.
Yes, I'm sleeping. I'm from
In the
from
dream,
my dream. Oh yes, I can hear you in my dream. So
maybe you are thinking,
maybe so,
but Asma sleeping confirm.
yes, Asma yes, but I'm Asma yes.
Where is that picture gone?
Yes. Okay.
Median cubital vein, basalic vein, BB, PB. B ভিতরে, C বাইরে. Okay. Okay, not sleeping now. I understand now. Basalic and cephalic, how you will remember? Basalic, B for ভিতরে. ভিতরে means inside. And C, cephalic, বাইরে. বাইরে means outside, means lateral.
The animal is difficult more than
Circle of wheels.
the big person.
Okay, okay, okay. This is right cubital fossa. Right cubital fossa.
So,
Hmm?
so, but what?
Huh? Yes.
Two. She's asking you about number two.
It is not two. It is two. Two. Two is anterior interosseous nerve.
Yes, efficient process.
Where is two? Two I cannot see. Ah, here, here.
Close your eyes. You can see. In the front, it's coming. You can see it's coming from the middle.
Yes, I can see.
One is middle nerve, and this is giving it one to the same dose.
Yes, number 12 is the median nerve. 12 is the median nerve, and coming down, 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 and here coming, giving anterior interosseous nerve. Okay.
The fourth apical artery, and three is the biceps tendon.
3 is biceps.
Tendon.
3 is biceps tendon. Okay. 3 is
Four is brachial artery.
4 is brachial artery. 4 is brachial artery. Brachial artery. Okay. Brachial artery coming down. Brachial artery coming down, and then it will give two branches. One is this one, another one 17. 17 is going 17 is ulnar artery. Hmm. 7 is common flexor origin. That's why it is in the medial side. That's why the 17 will be ulnar artery, and 13
Well,
7. Here is a 7. This is common flexor origin. Medial epicondyle will be common flexor origin, and lateral epicondyle will be common extensor origin. So 7 means it is medial side. As 17 coming this side, so it will be ulnar artery. 17 is ulnar artery, and 13 should be radial artery. 13 is radial artery, where we can check the pulse. Radial pulse. Number 15, radial recurrent artery. No need. Number 6 is brachioradialis. This is the exam picture. So, uh, 16, 16 is superficial terminal branch of the radial nerve. No need. 18, ulnar head of the frontotemporal. No need. So again, number 11, 11 is lateral cutaneous nerve of forearm. 11 lateral cutaneous nerve of forearm. Next to it is 5. 5 is biceps tendon. Uh, biceps tendon. No, 5 is brachialis. 5 is brachialis, and 3 is biceps. 4 brachial artery. 13 radial artery. 17 ulnar artery. Yeah, that's all. In this picture, number 16 is median nerve. Median nerve, median nerve, median nerve, median nerve. 23 ulnar artery, because this is little finger side, ulnar artery. And radial artery, we can expect this side. Radial artery is there. No. So median nerve 16, median nerve 16, ulnar artery 23, ulnar nerve 25. It looks like noodles. This part here. We are hungry, so it is looking like noodles. Median nerve 16, 23 ulnar artery, 23 ulnar artery, 25 ulnar nerve, 25 ulnar nerve, 25 ulnar nerve, 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 ulnar artery. This picture we know. This picture 11, 11. Where is 11? Deep palmar arch. 11 is deep palmar arch, not visible. Deep palmar arch. 19 flexor retinaculum. 21 median nerve here. Then 27 radial artery. 27 radial artery. Then 30 superficial palmar arch. 30. Where is 30? There must be another picture where these are missing. 30. Okay, this is 30. 30 is superficial palmar arch. Okay, 30 is superficial palmar arch. Hmm. And 31 ulnar artery. 31 ulnar artery going here, and 29 is superficial palmar arch. 30 is superficial palmar branch of radial artery, because 27 is radial artery going and giving palmar branch. This is Gavam's canal, right? Gavam's canal. Radial artery. Allen's test. Okay, now thorax.
Can we take a 5 minute break? I need to pray.
Okay, okay, we can take a break.
Did you sleep? No, but I prayed, alhamdulillah.
She's speaking little rapidly to prove that she's not sleeping.
No, والله والله مش عارفة أقول إيه والله بس والله مش نايمة.
What you're saying?
I am not sleeping, really. I am not.
That we know.
I am not.
But we know what is, as usual, Estra, what is sleeping Estra, what is hyper Estra, and what is hypo Estra.
You know, but really, I'm not sleeping.
Okay. Okay, so we can take a short break, maybe 10 minutes. After 10 minutes, we will start. Okay, we'll leave.